Could Sally Soriano come forward, please?
Good morning.
Thank you. I'm Sally Soriano with United for Single Payer and a former Seattle School Board member. Thank you for holding this important, timely hearing. Last June, a national Pew poll found that 60% of the American people favor a Medicare for all, single-payer healthcare system. Why? Because millions of people in our country and tens of thousands of people here in Washington state can't afford copays, deductibles, and premiums. The draconian escalation of prices charged by health insurance companies, rates in this state tripled this year, and prices charged by hospitals and drug companies are preventing low and middle income people from accessing care and are driving families into bankruptcy. At the heart of the problem is a market-based system that treats healthcare as a commodity, one in which executives and shareholders literally make money by denying care to those who need it. This legislation, Healthy Washington, would provide health care for all Washington residents, a public good, comprehensive, affordable, high-quality, publicly financed, seamless, in an equitable manner, regardless of income and assets. It would control healthcare spending, stimulate our state's economy, and pay for McCleary. Gerald Friedman, the economist, says that the state would save $9 billion a year. That's your get-out-of-jail-free card. Canada has it, France has it, Taiwan has it, and we want it. Thank you.
Soriano, thank you for being here today.
That concludes the testimony for this bill. There are 18 people signed in support. I'm not wishing to testify. And we're going to move back to Senate Bill 5747. Can I call forward Georgia Davenport, Ryan Whitney, Vivian Queija, and Kate Butt.
Please come forward. I know that we do have just 3 chairs, so we may need to play musical chairs a bit this morning. I apologize. Who'd like to begin?
How may I get materials to you? This should be.
Thank you. And in the interest of time and ensuring that we're able to hear from everyone today, I will ask that you keep your testimony to 2 minutes. Staff would like to implement the 2-minute time clock. And you notice the lights there on the desk. When it's green, please go right ahead. When it's yellow, that means need to begin to think about wrapping up. And when it's red, your testimony concludes. So thank you.
Madam Chair and members of the committee, my name is Georgia Davenport, and I'm the Interim Campaign Director for Whole Washington, a universal healthcare ballot measure. I am in favor of both 5957 and 5747. Dr. Gerald Friedman, who composed testimony for this committee, writes, "Rising administrative costs are the price we pay for a broken system of private health insurance, a system designed to increase industry profits even while denying adequate care to growing numbers of our citizens." Ask yourself and your constituents, what do we get in change for handing billions of dollars over to the insurance industry and to monopolistic drug companies and others? Fortunately, there is an alternative. A single-payer health insurance system would dramatically lower costs by eliminating much of the administrative burden, both within health insurance companies and within provider offices' billing and insurance operations. Combined with savings to be realized by reducing administrative costs and operation of health insurance and in providers' offices, and by reducing market power in areas like prescription drugs, Washington could save over $16 billion in 2019. Even after expanding coverage to all residents, this would leave savings of over $9 billion annually. If we can lower health care spending by 11% while improving access for all residents of the state, what are we waiting for? And now I continue my own testimony. As a result of people being uninsured or underinsured, nearly every family has a tragic story of loved ones dying due to lack of insurance, losing their homes, or setting up GoFundMe accounts to pay for their medical expenses. A poll conducted by Public Policy Polling shows 64% of Washington state voters want universal health care. As of 2017, 500,000 Washingtonians have no health insurance at all. You could be heroes. Save lives and billions of dollars by passing this legislation. Do the right thing for Washington state. Pass universal health care.
Thank you, Ms. Davenport.
I'm Vivian Queija, and it is really an honor to be here. Thank you so much for listening to these bills. They're so important. And I want to say that I'm a board member of Whole Washington. I support all of the single-payer bills here in this committee. I also want to let you know that I worked in the 90s for Dr. Crittenden at Harborview Medical Center. I was his first patient care coordinator. And sadly, I was also the patient care coordinator for children and teens there. And I have to tell you, going through the 90s and the changeover and what happened with bringing in that reform drove me from my job. I left that job because instead of helping patients, my entire time turned into fighting with insurance companies. And the single element that drove me from it that day I walked out and quit was having to argue with an insurance company to help a child get into Children's Medical Center for a brain tumor. I couldn't believe I was doing that. So I can tell you that system doesn't work. But hey, single payer does, and it works throughout the world. So single payer, with the study we have done with Gerald Friedman, is a system that would benefit all of us, even the greatest benefits for the poor. We could finance a health trust in Washington covering everyone without copays or deductibles. We have developed a plan which, with an 8.5% payroll tax, along with a 1% income tax and premiums on higher income residents, would pay for this. This would replace the insurance premiums and most of out-of-pocket spending so that over 95% of our residents would save money. And this would give you all the tools you need to keep it there.
That's right.
So I would say also that businesses benefit from this. A payroll tax of 8.5% will lower the overall payroll costs for businesses by over 2%.
And Ms. Queija, if you could wrap up.
I am.
Thank
Sorry.
you.
So I'm asking, this is going to create 100,000 jobs by making us more competitive. Do we want these jobs, or do we want them to go to Colorado, California, Oregon, Massachusetts when they are doing these? Let's pass it.
Thank you. And if you have any additional testimony that you would like to share, please give that to staff. Thank you. Please go ahead.
My name is Kate Butt. I am a volunteer for Whole Washington. I'm really honored to be here and to be able to speak to you. I'm going to continue with Dr. Friedman's words, and then I'm going to add a bit of my own personal story. Because health insurance is an especially large share of local government expenditures, the states, cities, and towns would be among the biggest winners from adopting a single-payer health program. Local governments will be spending over 20% of payroll on health insurance. A single-payer system would bring these costs down by 8.5% of payroll. A single-payer program would also fix a growing problem in local and state governance, the failure to provide for retiree health care costs. Under single payer, other post-employment benefits, OPEB, for state and municipal employees who retire and remain residents of Washington would drop to zero. Do you have any other way to provide this much help for your districts, localities? To repeat myself, what are we waiting for? And I am that Boeing retiree, and I spend a full 1/4 of my income for health insurance premiums. Thank you.
Go right ahead.
Thank you very much, committee. So before you, the document.
Sir, if you could introduce yourself, please.
My apologies. My name is Ryan Whitney. I'm a volunteer with Whole Washington and on the board of Whole Washington. Before you will find some documents. You'll have the Friedman's testimony as well as a pamphlet that we've printed out for you that helps digest some of the study's findings. Our study is still being formatted and worked on and will be released in March, but until then, you can see that with this very important industry of healthcare that we have significant savings opportunities as well as being able to cover everyone. I currently am self-employed, but I don't make as much money as I would need to in order to cover myself. Unfortunately, the ACA's level at which I would have to impoverish myself in order to be covered, I don't meet that standard as well. I go uninsured for the most part, and that's difficult for me. I look at other countries and I see how they serve their communities. I see how they, how little they actually have to spend in compare to us to do that. And I think it's preposterous that we would not consider trying to model ourselves after those other examples in the world. This is an excellent place to start. A lot of the work's been done for you. We have a study that can demonstrate how to effectively pay for it. I hope you'd consider doing this. Thank you.
Thank you to each of you for being here today. Very much appreciate it.
Madam Chair, there were 13 other witnesses who signed in not wishing to testify, 9 pro and 4 con.
This concludes testimony on Senate Bill 5747, and I'll close the hearing on Senate Bill 5747. I see